Hello and welcome. Dr. Sheila Kilbane here, Integrative Pediatrician. I wanted to shoot a quick video about ear pain and flying. I was actually on vacation recently and got a call from a friend of mine whose children also happened to be my patients. And what happened is his 4-year-old daughter, on their flight to their destination of their vacation, she started to have some ear pain when they were landing. Her pain ended up getting worse and worse, so they took her to the emergency room, and she was diagnosed with a double ear infection and placed on antibiotics. She was only going to be on the antibiotics for about 36, almost 48 hours prior to their scheduled flight home. His question to me was, is it safe to fly? Because his daughter has never had an ear infection in her life, and because she had already begun to improve significantly after only being on the antibiotics for, it was about 18 hours, I said, I think that it's safe to fly home. And what I think that we should do is a dose of ibuprofen before she gets on the airplane so that we can help with her pain and we can help decrease that inflammation a little bit while she's up in the air and going to need to be equalizing as they take off and land. The other factor in her case that I thought it was safe for them to fly home is her age. So she is 4, and at the age of 4, your eustachian tube, which is the tube that drains from the middle ear to the back of your nose, is much more vertical. And so that means that the fluid in an infection, there is an easier time for that fluid to drain because that eustachian tube is more angled. And because she doesn't have chronic ear infections, I didn't feel she would have chronic inflammation in her eustachian tube, making it a little bit more difficult for her body to take care of the infection. If you have a baby who's 0 to 2 years old, their eustachian tube is much more horizontal. So it can be a little bit more challenging for us to deal with that fluid in their middle ear, especially if they have chronic ear infections. So I wanted to just let you know about this case. Also, with some children, I may have recommended that we do Benadryl in addition to the ibuprofen. But since this little girl did not have a whole lot of congestion and she doesn't have any allergies, I thought the ibuprofen would be enough and that we did not need to do the Benadryl as well. So children with ear pain, especially children with ear infections and ear pain, we need to take it on an individual basis depending upon the child's age, their medical history. Do they have recurrent ear infections, or is this just a one-time, is this their first ear infection? Do they have allergies? Do they have a big congested nose? That's also going to make it more difficult for them to equalize the pressure. So just wanted to share this with you because I thought it would be helpful for many of you. Thanks so much for listening, and be sure to check out my website at SheilaKilbane.com. Have a great day.